go ahead and get started. All right. Hello, everyone. Thank you for joining DataCon LA 2021. Welcome to the Data for Good track. My name is Courtney Feller. I'm your host, and our host today is Steven. We are moderating the chat and Q&A for this session, and today we have our guests JP Petrucione and Shawn Zargham, and they will be presenting the session title or session. Scaling sentiment using digital surveys to geotarget vaccine distributions in California. This is a very near and dear thing to all of us, right? As for the past year and a half, we have been plagued by this lovely sickness that has kept us doing this more virtual conference rather than being able to kind of be shoulder to shoulder and shake hands and see each other face to face, right? So a little bit about both of our session, presenters. JP is a deputy director of communication insights at California Office of Digital Innovation. He joined the Newsom administration in 2019 as the governor's director of digital media, in addition to the ODI in October 2019. He's had applied his background in politics and digital media to developing new ways to engage Californians and bringing their needs and concerns into policy and service design. Today, the Insights team is experimenting with improving out innovative approaches to human-centered research, demonstrating that government can gather and apply sentiment data at scale in real time and cost effectively in ways that are replicable by any state or other jurisdiction. So I'm glad you're sharing that with other states and other cities. I'm pretty sure they'll definitely need that. Prior to joining the Newsom administration, JP served as global digital director of public policy at Airbnb, and many years before that, he served as the then Mayor Newsom's deputy communications director. Join me in welcoming JP.
Thanks.
And also, got our second presenter, Shawn Zargham. Shawn is the CTO and founder and co-founder of Syntasa. I hope I'm saying that correctly. He is a successful entrepreneur and technology leader with deep expertise in analytics, SAS, and cloud computing. He has a proven track record of devising winning technology strategies and expertise in architecting, patenting, and developing and deploying large-scale solutions in high-performance, near real-time event processing, machine learning and AI, analytics, and optimization. Shawn is skilled in building strong partnerships with key customers in pre-sales, deployment, and support phases with a history in evangelizing transformational changes and establishing thought leadership. His experience includes leading large teams in software development, product management, quality assurance, and customer service organizations, as well as leading technology and product due diligence activities with investors and acquisition partners. He is currently the CTO and co-founder of Syntasa. Previously, he was co-founder of Telerix and other companies. And again, join me on welcoming Shawn as well. Without further ado, I'll let you guys go ahead and start off the presentation. Hope I didn't take up too much time with the intros. And Steve and I will be hanging out beside you guys to do the Q&A at the end of the session. So,
cool. Thanks, Courtney. Appreciate it. Everybody, thank you for being here. I appreciate all for joining us today for this talk. We are going to be talking today about the work we've done to apply sentiment to California's COVID-19 vaccination effort, and more broadly, how we at ODI are experimenting with sentiment data in California. Courtney introduced, obviously, I'm JP Petrucione, and Shawn will be co-presenting. We'll be tag teaming throughout the presentation. I'll be speaking at a high level about the work we did, and Shawn will provide a little bit more detailed insight into the advanced analytics aspects of the project. And so with that, I'll start with a brief introduction of ODI, a little bit of background. So California's Office of Digital Innovation was created by Governor Gavin Newsom in 2018 as part of his first budget. We take a holistic approach to problem identification and problem solving. As part of that, we take into account technology, policies, processes, systems, people, and data. Ultimately, though, our mission is to use digital tools and human-centered design to reimagine and redesign government services. And central to that mission, the interesting part from my perspective especially, is that it's bringing the voices and experiences of Californians into policy deliberation and decision-making. And that's where sentiment comes in. Over the last year, we've been experimenting with ways to gather and operationalize sentiment data. And our belief is that people's attitudes, concerns, and needs, and the resulting actions that they take or don't take, which is how we think about sentiment, are vital components or vital data for the work that ODI is doing, and really that all of government could be doing to reimagine and redesign government services. As Courtney said, COVID's been with us for a long time, and it's been, both a horrible experience for so many, and it's been an incredible opportunity to experiment and to do things a little bit differently. And so with COVID, the state's vaccination response effort offered us an excellent opportunity to put our belief and understanding of sentiment to the test. So the problem that we encountered and the problem that we were trying to solve for was that by mid-April of this year, as the vaccine opened up to all Californians, it was clear that there was a pretty significant equity gap emerging in the vaccination effort. And the problem that needed to be solved was pretty clear, which was basically how do we get more Californians vaccinated, particularly those in historically disadvantaged communities. This graph shows, this is from our data, shows that between the time vaccinations first became available and early May, the least advantaged Californians, which is the dark blue line, were getting vaccinated at a rate 25% lower than the most advantaged, the light blue line. This illustrates the reality that those with the means and the time were managing to get vaccinated first, despite the fact that the mass vaccination sites were located strategically in less advantaged areas. At ODI, we saw this as an opportunity for a pivot. We realized that the sentiment data that we had would allow us to inform a different and expanded way to think about vaccine resistance and vaccine hesitancy. When we started this project, the paradigm that we were working within was that the key to unlocking hesitancy around the vaccine was persuasion. We made the shift to expand that paradigm to also include the willing, not just the hesitant. And the willing in California have always been the largest percentage when we look at willing, unsure, yes, no, et cetera, in relationship to the vaccine. So we thought it would be incredibly valuable to understand and help remove the barriers that they were experiencing to getting vaccinated. So what we did is we used our sentiment data, really, which provides granular, the ability to provide really granular insights into both willingness and hesitancy and the reasons for both, to help get more people in total vaccinated, but in particular, more people in those least and less advantaged communities. And this is where I want to talk about the innovation that we made here. It's so simple. And this is one of the things about ODI's work, is that often the innovations are big. Sometimes they're quite small. Sometimes they're using tools that already exist in a different way, or an approach that already exists in a slightly different way. And so in this case, the innovation that we made was to tap into California's stream of website data. What we did with that is we placed surveys on 12 of California's most trafficked websites and used that to gather sentiment data. It's important at this point to put it in context, which is that California, as you might imagine, it's an enormous state, and it has an enormous digital footprint. In the first quarter of 2021 alone, an average of 8 million Californians, or people, visited ca.gov websites every week. And what we thought here was their online actions are really an essential source of data. So again, we fielded surveys on 12 of the state's most trafficked websites. We started asking questions about COVID-related non-pharmaceutical interventions, and then we later expanded that to vaccines. The survey was voluntary. It was, and it appears as a static banner. You see it as it appears on the DMV, which is actually, interestingly, as you might imagine, it accounts for over 50% of our responses. So again, a static banner on these 12 websites. We use SurveyMonkey to build the survey. We asked demographics and zip code. Part of the power of this, in addition to tapping into the traffic, is the fact that we own the instrument. We could change it in an instant because we controlled it. And of course, this approach and the data that we gathered are wholly and totally compatible with traditional survey data. To date, we've gotten over 90,000 structured responses. The survey has been running, as it notes on the slide, since January 28th. We've gotten over 90,000 structured responses, including over 80,000 open-ended responses. And the volume of this data has allowed us to model hesitancy all the way down to the zip code level, something that Shawn's going to touch on in a few slides. But this approach to gathering data is the way we did it using state websites is really just one of several principles that we've identified as something of a playbook, or just, as I said, principles around how to work with, how to gather and apply sentiment data. What you see here on the screen are the 6 principles that we've currently identified or worked with in different settings. When used in concert with one another, what they do is they offer a scalable and replicable approach to gathering structured and unstructured data about what residents are thinking, feeling, saying in relation to any given policy, issue, or service. It's an approach that we believe is replicable by any state or even jurisdiction, government jurisdiction in the country. And these principles aren't sequential. It's not a stepped process. I've already discussed the first one, as I've noted, how we're using state websites to gather the data. And over the next 11 slides, Shawn and I are going to illustrate the other principles in practice as we implemented that pivot to find the vaccine willing and inform the state's efforts to get them vaccinated. But before I go much further, very quickly want to talk a little bit about the context that we are operating within and who we were working with. So this was, COVID in any government agency has been a truly cross-functional effort. Many, many different teams from different state agencies and departments, as well as vendor partners. In relationship to the sentiment data work, specifically, we were working with teams from the Department of Public Health, which was responsible for orchestrating and coordinating the overall COVID response, including the partnership with the third-party administrator, in California's case, that was Blue Shield, collaboration with the county local health jurisdictions, as well as overseeing communications, advertising, and community outreach campaigns. In addition, the Office of Emergency Services, which among many other essential functions, built mass vax clinics, deployed mobile clinics and pop-ups to high priority locations, as well, which is, something as well that the local health jurisdictions did. Lastly, there was my team, ODI. We were among many teams using data to inform the larger effort. And in that effort, we were supported by Syntasa and Google. As Courtney noted earlier in his introduction of Shawn, Syntasa are digital behavior specialists. And they've got really deep expertise in big data processing, cloud computing, AI, machine learning technologies. And in practice, Syntasa also expand my small team's capacity, providing data scientists, data analysts, and really awesome thought partnership. In addition, we use Google Cloud as our computing platform, as well as Google's BigQuery, Dataproc, and natural language processing, which Shawn will touch on later. So returning to our principles, Shawn will address what we mean when we talk about apply rigorous methodology.
Thank you, JP. So as JP mentioned, the rigorous methodology is a key component of our work here. I'm going to start by talking about our analysis of the public survey data across the high-traffic ca.gov websites that was mentioned. The surveys were ongoing and included structured and free-form questions. So we collected anywhere from a few hundred to a couple of thousand responses per day, depending on people's level of engagement and the ongoing news events. Like when Johnson & Johnson vaccine was paused for a period of time, we were seeing a higher level of participation. The most important consideration about any survey is that they must be representative of the target population. Ideally, everyone is after probability sampling, but in practice, everyone must adjust for selection bias. Obviously, visitors to ca.gov websites are not a complete representation of the people of the state of California. There's always concern about participation among different cohorts based on age, gender, race, ethnicity, and income levels. To correct for demographic biases, we compared our distribution with the census distribution. In this example, you can see that the younger age groups showed less participation than the older age groups. We analyzed all dimensions like race, ethnicity, and income levels and applied standard weighting and ranking techniques to correct for demographic biases. This was the easy part. If we go to the next slide, the hard part was actually try to identify latent selection biases. For example, how representative are people who visit ca.gov site? Not everyone is online and goes to ca.gov. And more importantly, how representative are people who decide to participate in these surveys? This is generally a problem with all surveys. Even the probability surveys that select their audiences randomly still have this kind of a bias because not everybody accepts their invitation to participate. So people opting in to respond introduces some bias by itself. Now, here we had the benefit of collecting responses across many different websites. And one thing that quickly became apparent was that how different people visiting different websites were in terms of their attitudes and sentiment towards vaccination. Also, fortunately, there were several other surveys being conducted by universities and news organizations at the same time, and we used their results to validate ours and ended up with rejecting some of the sites because they were showing a higher than expected bias towards accepting the vaccines. For example, people visiting the COVID-19 website were showing a much higher willingness to get vaccinated than people visiting the DMV site. So after correcting for demographic and representation and removing the sites that showed strong bias, we compiled our vaccine hesitancy results and compared them with the COVID-CAST survey results. COVID-CAST surveys are fielded daily on Facebook and are analyzed and published by Carnegie Mellon University. In our surveys, we looked at the people who said no to vaccinations, and on the COVID-CAST, their question was a little different, so we selected probably no and definitely no. And as you can see, there's really good alignment between what they refer to as hesitance, which is probably no and definitely no, with what we refer to as no. And the numbers are pretty encouraging in that sense. So this gave us good confidence that the ca.gov survey results can be used to gain deeper analysis and understanding and provide insights that can help the vaccination effort. JP will now tell you a little bit more about how we leverage both structured and unstructured data to maximize our insight.
Cool. Yeah, so Shawn mentioned that our survey instrument gathered both structured data and unstructured data. Simply put, we asked people to tell us more in relationship to the structured multiple choice. And our experience and our practice with this data is that it's both extremely valuable. Both of them, are extremely valuable when it comes to understanding and using sentiment. So what you see here is a screenshot of an analyst dashboard that our data engineer, Rebecca Sanjabi, built. This dashboard brings these data together, which enabled us to explore them in relation to one another. The subset shown here shows the most socioeconomically disadvantaged respondents, which is HPI quartiles 1 and 2, who responded either no or unsure about taking the vaccine. I mean, the data are super interesting, and they gave us much deeper insight into the most common concerns and barriers to getting vaccinated. For example, it's an emergency vaccine, it's not tested, or I've already had COVID, so I have antibodies. It really helped inform the open-ended, the unstructured, really helped inform the more structured data, which is something that we used in terms of creating new questions as needed, and trying to understand what we weren't. It's almost like we knew what we had, but it helped inform what we didn't know. Another really cool aspect of our work with structured and unstructured data is the practice of actually quantifying it and using advanced analytics like natural language processing to do, which Shawn is going to show you next.
Thank you, JP. So I'm going to dig a little deeper into how we quantified the unstructured data. So the survey had two open-ended questions that encouraged respondents to share their thoughts. We were pleasantly surprised by how many people took advantage of this open forum and how much was shared. Overall, as JP also mentioned earlier, about 80,000 open-ended responses were received. Initially, we reviewed the reviews were done manually by one of the team members, Clara, who categorized the feedbacks into different topics and began to analyze them. But once we realized the volume of the data, we started using natural language processing, sentiment analysis, and topic modeling. So we used Google and open source natural language processing algorithms to understand parts of speech, do sentiment analysis, do toxicity analysis of all the free-form responses. We also applied some encoding techniques, BERT to name one, and then combined that with unsupervised clustering, and found out that it's a very powerful combination for identifying the conversation topics. So this allowed us to quantify and better understand the dominant topics, the sentiment around those topics, and the changes as they were occurring. The conversation covered a wide range of topics and evolved as the concerns and the conditions on the ground changed. So automated and frequent analysis of these free-form feedback helped us identify some of the frictions that people were experiencing and that the reasons that perhaps were slowing down the vaccination effort at different stages. For example, hearing about the different groups, like JP was mentioning earlier, and analyzing the concerns, it became apparent that availability of and appointments was something that needed to be focused on, and that helped with the areas that needed the vaccination the most and the areas that were actually ready to be vaccinated. Back to you, JP.
Yeah, and that last point is really interesting and very much core to our pivot to expand the paradigm that I was talking about earlier to focus on the willing as well. It's not only were we able to find out why, we were able to apply that why in relationship to the who, in this case, willing. And what we found is this graph really clearly illustrates is that access, availability of an appointment, proximity, as we discovered, to an appointment, those were key blockers in preventing people, in particular the willing, in getting vaccinated. So with that said, I'm going to do a very quick description of one of our further principles, which is apply an equity lens. This is very much another core component of the work that we're doing with vaccine sentiment. And you've heard me mention a few times already the least or most socioeconomically advantaged or disadvantaged Californians. And that's because in California, we have use of what's called the Healthy Places Index, which is an index which combines 25 different indicators into a single location-based indexed score broken down into quartiles. Use of this tool, one, it was the primary metric that the state was already using to inform and measure vaccine equity. And use of this tool in our work allowed us to provide a very high level view of equity while still being able, of course, to drill down on specific metrics. And HPI was one of several data sets that we ended up joining with the sentiment data, which Shawn's going to talk about in the next slide here.
Thank you. Yeah, let's talk a little bit more about like how we added more context to the data and a little bit about the plumbing that had to go into this. So to add context and gain a comprehensive view of the vaccine sentiment, we combined our survey data results with other data sets. So the combined data sets helped us make the results more actionable and helped us sharing the data with various partners based on their requirements. Let me go over the data sets here, and JP will talk a little bit more about the activation partners a little later. So the first data sets that we used was the Healthy Places Index, which assigns a single index to locations where a low number indicates lack of access to resources and a high number indicates availability of resources. So by overlaying this data with the survey data and overlaying it at the zip code level, we had a better view into the groups that were responding and had a better understanding of the type of the conversations were happening. Another data set that was brought in was the vaccination rates. This was really important because we were focused on outcome, and the outcome here was vaccination. And now by bringing in the vaccination and combining it with sentiment and the HPI data, we began to form a better view of where sentiments are positive or negative towards vaccination, which locations there are, and how much progress has been made in terms of the vaccination rates. We finally brought in two more data sets. One was the census data, which was really helpful because as part of our analysis, this being a public health use case, we only know of the characteristics at a location level, and census give us that understanding. So we can now understand demographic characteristics, and this informed our modeling effort, which I will talk about a little bit later. And then finally, the last data set we looked at, which was the most massive data set, was the engagement data. That is the first party anonymized clickstream data on the ca.gov sites. Various sites were analyzed, including the MyTurn website that was heavily used for making vaccination appointments. So this now allowed us to build a comprehensive view of sentiment, characteristics of the locations, their HPI index, and their engagement with the tools like MyTurn that were meant to help facilitate the vaccination process. We used Google Cloud Platform to build 4 types of production-grade pipelines. 4, 1 for ingesting and cleansing the data, 2 for aligning and combining multiple data sets, 3 for applying AI and ML algorithms, and finally, for making insights actionable by feeding dashboards and downstream users, downstream systems, and stakeholders.
Cool. And actually, Shawn, I want to add, from my perspective, this is one of the most interesting things we did, not the Google Cloud Platform piece, although that is very much an interesting component, but the contextualizing of data by joining it with both third-party and administrative data makes sentiment data actionable and applicable in ways that just sentiment on its own is not necessarily. So I just wanted to reemphasize that as a principle. And with that, I'll move to the next slide.
Thank you. So based on the availability of the data that we had access to and the needs of the stakeholders, we decided on analysis of the vaccine sentiment and other data at the zip code level. Everybody wants it really at a much lower level all the times, but not every data element is available. So that was part of our analysis to decide what was the best level we could get to provide this information in order to keep it useful for the stakeholders. So the color coding that you see here, the orange represents the zip codes with the largest target population. That is the ones or the folks that are willing but unvaccinated, and blue is the smallest target population. So we looked at people who are hesitant, and the opposite of that being willing. We also look at the vaccinated population, and we looked at the population of each zip code, and this allowed us to be able to have a ranking of the zip codes based on the largest target populations. So how we went about doing this is that we first determined the population, the percentage of population that said no for locations where the combined ca.gov and the COVIDcast surveys had statistically meaningful results. Then we used AI and ML modeling techniques to estimate hesitancy for each zip code. We tried a number of different techniques, and we finally ended with the linear regression as something that gave us the level of stability that we wanted for the kind of analysis that we were doing. Now, the models learn and score based on census and HPI features with hesitancy as the target variable. So we learned from those features and looked at the hesitancy, and then we applied those to smaller geographical locations like the zip codes. So we then added the vaccination data, as I mentioned, to identify areas that have the highest number of individuals that are willing to be vaccinated and are not vaccinated. So basically, we want both hesitancy and vax rates to be low, and those are the places where the lowest friction towards vaccination is there. And then looking at the size of the zip codes gives us the best ROI. So the logistic teams could use this information in addition to other information to prioritize and look at locations where they could get the most uptake. Now I'll hand back to JP, and he's going to walk us through how the results were used.
Cool. Yeah, at this point of developing data that is actionable is one of our principles, and it's in many ways the most fundamental principle, because if you do a lot of work just for the sake of creating data or a dashboard, but you can't do anything with it, it doesn't do a whole lot of good. But in the case of the vaccine sentiment, we made the data actionable in several ways. One is creating the model that Shawn was just talking about. We think of that and in practice as productizing the data. So we developed that hesitancy scoring model, and we made the data available to the different data practitioners on the different CDPH and TPA third-party administrator teams on a bi-weekly basis. We would do a bi-weekly data share via email, give them the data. This included Duncan Shannon, which is the ad agency, the red logo that you see there. They were the ad agency that was doing obviously the advertising and the communications around the vaccination program. they used the data and actually are still using the data to inform targeting and ad buys. In addition, the community outreach campaign incorporated our hesitancy score data into their data tool, which is called CORD, which stands for COVID Outreach Rapid Deployment, which is used by local CBOs to inform and guide their direct engagement efforts with community. And then the county local health jurisdictions worked with a third-party administrator to get the data, actually through the third-party administrator, to use the hesitancy scores to inform deployment of mobile and pop-up clinics, which is something that also informed OES's, the Office of Emergency Services, deployment of mobile and pop-up resources as well. And as part of the work that the local health jurisdictions and the TPA did, we worked directly, the ODI team worked directly with TPA analysts to provide guidance, support, education, in how to use and understand the data. There was a lot of back and forth, there were a lot of questions, and it was really important for us to make sure that any analyst outside of our team who wasn't familiar with how we developed the data knew exactly how it should be used. And that's a pretty important component of productizing any data set like this. And lastly, there was one last part. The other thing that we made available to the analysts at the TPA were the open-ended feedback dashboard that Rebecca built that I showed earlier. They found that extremely useful to be able to, on their own, go in and and to look at different ways that begin to understand the different indicators that were informing willingness, hesitancy, etc. All right, so now all of this presented and said and done. The obvious question is, of course, did this work make a difference and did it have an impact? Before answering that question, though, it's essential, I think, to acknowledge that sentiment was one of a myriad of levers at the state's disposal in the COVID response and the COVID vaccination effort. Of course, the ad and outreach programs that Duncan Shannon were creating reached millions of people. Every day, more and more people were getting vaccinated and acting as messengers in their communities. There was daily community outreach through CBOs, and of course, Delta happened. All of that and more had an impact on the problem that we were trying to solve. And at the same time, we really believe that our sentiment work was a lever that had a material and positive impact. As this slide shows, from the time that sentiment scoring data began to be used to inform the vaccination effort in early May, the state, correspondingly understanding the data, began to prioritize pop-up and mobile distribution, which is what that small graph in the middle illustrates. It's a screenshot of a deployment logistics spreadsheet. And from that point on, within the first 30 days of beginning to use the vaccine sentiment scores, 70% of vaccinations delivered to HPI quartiles 1 and 2, our target populations, were administered at a mobile or pop-up clinic. And as this next slide shows, as sentiment began to be used, and this is, I should note, the same graphic that I showed earlier in the presentation, but just it goes, I showed earlier just May to May, and this shows from May to August. As sentiment began to be used, the gap between vaccination rates among the most and least advantaged Californians, the least advantaged being the dark blue, the most advantaged being the light blue, as the sentiment data began to be used, that gap reversed. Back in May, HPI quartiles 1 and 2, the least advantaged Californians, were being vaccinated at a rate 25% lower than the most advantaged Californians. By this past August, quartiles 1 and 2 were being vaccinated at a rate 57% higher than quartiles 3 and 4. And with that, I will end the presentation and open the floor to any questions.
JP, Shawn, definitely appreciate you guys' presentation so far. Steven, there you are. Hey, any questions in the Q&A that you see that we can go and kind of, actually, I think you have a question you kind of put in the
Q&A. We have not incorporated using surveys through social media because we would, for a number of reasons, one, we would have to ask the state departments to place our survey on their social media. The more effective way would be to pay for it. We don't have budget for that. But we are talking to Syntasa about developing some social scraping tools to look at Reddit, to look at Twitter, et cetera, to create yet one more sentiment data stream in relationship to any given issue. It could be rental protections or vaccine. So that'll be a tool that we'll incorporate moving forward.
Cool. Thank you.
Yeah, how long did it take to get this project up and running? So we began gathering sentiment data in late January around the non-pharmaceutical interventions, wondering about people's attitudes towards the stay-at-home order, towards wearing masks, towards social distancing, et cetera. And again, by May, we realized that we had a really phenomenal data set, and we had started asking questions about the vaccine in early April. It took us about, Shawn, and check me on this, about 4 weeks to 4 to 6, you remind me, to build the model. It took about 4 weeks.
Yeah, it was an iterative effort. Kind of the first round of the models came out in about 3 to 4 weeks. The level of the stability of the results was not as good as we wanted it. We iterated a few times, and probably by weeks 5 or 6, we had a good stable model that we could leverage.
And I see the question, do we see income disparity for the vaccination rate? Lee, I'd have to look at the data, and happy to share with you what we see. I don't know the answer to that off the top of my head.
I can probably jump in on that.
Good.
Like the HPI quartiles 1 and 2 and 3 and 4 are highly correlated to income levels. They have other variables in there. So we decided to show the results in terms of HPI quartiles, but the income levels would be fairly similar, so that the folks in the lower income categories would show a lower rate of vaccination initially, and then with the results and the effort that JP talked about, the rates have increased compared to the other group.
And that's again the power of HPI as a single metric. It gives us the ability to think about race, ethnicity, health risk, as well as things like income, all in one, and put that in the context of sentiment. And I see there's a question about, did it save the state money by knowing where resources should be allocated? We cannot say with any certainty that it did or did not. And we can say that the state in its pivot and our pivot in support of that to trying to bring equity into the actual distribution of resources has, in fact, as that last graph showed, increased vaccination rates, in particular amongst the most underserved. So you could make an argument, and non-economists could, if they looked at the data, an argument that we ultimately saved California money by doing that. But again, can't say definitively. And one thing I would add, if there are any state teams on here, so yeah, what are some of the lessons we learned? So one of the lessons we've learned is that, and actually one of the lessons we are trying to figure out if indeed it's a lesson, is this has been an experiment. We found really good success with the vaccination work. We're now applying a similar approach of gathering data at scale using state websites, the qualitative, quantitative. We're now applying that to the emergency rental assistance program in California, which is to help renters pay back rent. And we're further testing it to see if it actually works. So, I think right now, without further testing it, the lesson learned is that sentiment data has incredible value if it's gathered and analyzed and applied in a methodologically rigorous way, and joined with administrative or third-party data. So right now, I would say that sentiment data, the most important lesson is that sentiment data is, in my opinion, a missing link in the state's effort to better serve, which again is ODI's mission, to better serve Californians and improve services to do that. I don't know if that answers your question about what lessons were learned. Shawn, do you have any lessons learned about?
I think from a technology point of view, in data-intensive projects like this, the lesson learned was that we had to really be agile, even more agile than we initially thought we had to be, as conditions changed, as the data feeds changed. Sometimes some collectors may not work the way we expected it, or some data change that was beyond our control, or the feed from, for example, other parties were also changing a lot. So I would say just that dealing with the change was more than we had anticipated initially and had to adjust.
Awesome. That's some interesting stuff. JP, Petrucione, Shawn, Zargham, definitely thank you guys both for your presentations today. Definitely great to hear the sentiment data is kind of one of the things you guys are bringing on for now for this day. And I want to take that for my information and my future kind of trainings and work for as well. Right? So I appreciate you guys for your presentation again. I appreciate you all here joining the session today. If you guys have any questions, please feel free to reach out to either JP or Shawn through the Hopin app. We'll be happy to hopefully share any other information they may have for you all, and can definitely hopefully kind of expound on what they have been doing before, right? Like I said, guys, again, thank you for joining the presentation today. Have a wonderful day. Thanks for being part of this year's DataCon LA. Enjoy your next
Thank you all.
Thank you.
Thanks, guys.
Bye-bye.
Bye.